Before North Carolina expanded Medicaid, over 400,000 children in our state had at least one uninsured parent. What that meant for families is they weren't able to access preventative care that they needed, routine medical care that they needed, care for chronic and major illnesses like cancer and diabetes.
You know, my background was healthcare, and I toured when I was at that hospital in Winston-Salem. I toured and saw patients in our ER and our clinics that had no insurance. And sometimes we'd strike up a conversation and they would tell me the financial difficulties of having to come to a doctor, and they only came when they needed to. So that was one aspect, was the people that I had met years ago that really pushed me forward in saying, we got to expand Medicaid in North Carolina.
As someone who has been through the pandemic, had 2 children, as a teacher, and been now through a natural disaster, I think it's more important than ever for people to have access to mental health, to be able to process these really difficult life challenges. And it's something that not enough people are talking about, I feel like. We talk a lot about healthcare, but we don't always necessarily include mental health in that, but it is a big part of it in order to be able to live sustainably day to day and not feel like you're drowning.
When we did Medicaid expansion, the state got a $1.6 billion bonus for signing on and agreeing to expand Medicaid. And we could use that money in any way we felt like we needed to use it. And guess what? We used half of that money for mental health reform. We increased rates because a lot of providers had not had an increase in rates for years. So we increased rates, but we also created new access points. We're opening up more beds. We're going to provide more outpatient service, crisis centers, sometimes it's what they're referred to, and we're using the bonus money from the Medicaid expansion to create this strategic plan for mental health to respond to the needs of people across North Carolina, because mental health is a crisis in our state. And we're continuing to try to address areas where we know, whether it's in the schools, in the churches, where we know we've got to address that.
I just recognize that it was really challenging to go through so much in such a short amount of time, and then add on top of that the pandemic and Hurricane Helene in Western North Carolina, and I just realized that I needed help from a professional to process all the trauma that I had been through in such a short amount of time in the past 4 years. And because of Medicaid, I was able to go through Black Mountain Counseling and receive care and help at no cost, which was huge.
I mean, I received hundreds, if not thousands, of these little postcards, and I read every one of them. And I have some of them still on my desk in the chamber that I saved, because I want to remind myself, this is why we did that. We did it for the 640,000 people today that are enrolled, and we did it because they needed help.
At NC Child, we celebrate Medicaid expansion, and we are committed to preserving it for the children and families across our state. It's one of the most important things that we can do.